introduce myself and then let Helene introduce herself. And then we'll go around and kind of do some quick intros. So I'm Shalom Mukherjee. I'm a hospitalist at UW Medical Center, Montlake. I direct our faculty development program for our division. My scholarly interests are in clinical teaching and in optimizing clinical teaching. My clinical work is in the UW Montlake pre-op consult clinic, and I do inpatient medicine consult. Helene, do you want to say a few words?
Sure. I'm Helene Starks. My home department is in bioethics and humanities, but and the reason for that is that my area of expertise is in palliative care and systems change and teaching complex communication skills. But I am also 50% funded by the Division of General Internal Medicine to be your academic research coach. So I have a lot of time that is available to basically help you do your best work. And we're going to talk a little bit about that today, but literally I can be there from the first idea to a completed project and then on to the next one. So anytime, anything you need, I'm here for you. And I'll be teaching a couple of sessions this round. So look forward to meeting you all some more.
Great, thanks, Helene. And I successfully advanced the slide. That was amazing. I love this shared control here. So you can see who all is joining us for this certificate series, some of whom are here. As you all know, that we're really asking you to come to at least 5 of them live, and thank you for being here today. Just briefly to kind of recapitulate our goal is very much to support you in any way that we possibly can as a professional development certificate group in achieving your aims and your goals in faculty development and career development. And so the components of that, of course, it'll freeze up now. There we go. These are all the sessions you can kind of see here, and you have this as well in front of you. We've separated it into scholarship, core competencies, leadership skills, teaching skills, and growth, which kind of encompasses things like mentorship and menteeship. The email I sent you said something about a career enhancement project. We'll talk more about that moving forward. Please do take a moment to email Veronica with your ideas for your goals and challenges and what you think might be a good career enhancement project, and we'll follow up with that. The mentorship aspect of this program is integrated into the career enhancement project aspect. And as we get to know more about you and what your goals are, we'll connect you with the faculty for the program as well as other faculty to help you move forward in reaching your goals and integrate some mentorship opportunities along the way. This session is not going to be the end all on how to write an abstract. It's the beginning, it's a discussion, and I hope you'll reach out to me, Helene, and others in our group to continue to work on abstracts as you start having ideas for abstracts and moving forward. Am I still driving here? We talked about this. Here are some reasons why doing an abstract would be a good idea. Let's not spend a lot of time on this. I do want to point out that there are opportunities for abstract submissions coming up. We'll share these slides after the talk, and you can take a look at these slides. These are some meetings that are coming up that have to do with general internal medicine and Society of Hospital and Hospitalist Medicine. And here are some that have to do with education. Some of these have deadlines that are coming up. And so if you have projects that you're working on, you're wondering if it's something you can write up as an abstract, please do reach out to us, and we can talk about that and work with you on putting an abstract together. Here are the objectives for the rest of the time today. Helene will be covering this and leading a discussion around it. I have a different talk altogether on writing case reports, which are kind of tacked on to the end of this talk. I would say let's do due diligence and talking about abstracts as a whole, and then I'll set another time and invite folks to talk with me individually or as a group and talking about case reports moving forward. So with that, I'm going to turn things over to Helene.
Thank you. It was really great to hear all of your experiences, because that will also focus a little bit about how we have the conversation that's coming up. I'm trying to get control back. There we go. So what I wanted to kind of help you think about, because a lot of you were talking about the challenge of choosing the right 150 words or 500 words and how hard it is to do that. So I'm going to be spending a lot of the time today really talking about style. Because at the end of the day, an abstract is either a pitch or it's a short story. It's a highlight of a much bigger thing that how do we encompass the whole thing when really we only have this much that we have to talk about. So that's really what we're going to talk about. And then from the perspective of a few of you who are talking about the reviewer, I always think of a writer as sort of three persona. So the first is kind of your big picture, which is like you're writing the first draft and the first whatever drafts for yourself, right? Because first you're just like, what is the story I'm trying to tell? Like you have a lot of them. You kind of have to work it through for yourself. Then that's a place where you want to have a big picture perspective and just kind of free write and don't put any constraints on what you're writing down, but be very generative in terms of all of the ideas that you're trying to communicate or that are in your head, so that you can get them out of your head. And then your second persona, your editor, is the one who's going to come on the second pass and start to tidy things up, right? So you may have actually one idea that turns into 6 ideas. Your editor is going to make 6 buckets and help you start to parse, because what you're going to tell in 150 words isn't going to be about all 6. It's going to be about 1. So part of it is just getting it smaller. Then your third persona is your reviewer. So after you've written many, many drafts and now you know what you're saying, you bring on your reviewer perspective, which is the reader's perspective. Because ultimately, at the end of the day, writing is not for you. Writing is for the person who's going to read it. And so the final step in doing an abstract is knowing how the reader and reviewer is thinking about what they're doing. So we're going to give you the rubrics for how to think like them. And along the way, we're going to give you lots of tips and pitfalls. And we welcome anybody, if we're at any time where you're like, hey, I tried that and it worked or it didn't work. This is a group conversation. It's not me talking to you. It's all of us learning from each other. So let me see if I can get back here. So whenever I'm going to talk a lot about audience, and my pitches are always audience, purpose, product. If you spend any time with me, you're going to hear me say that 1,000 times, because if we're trying to do an elevator pitch, we have to know who we're speaking to. So in all of these, there are choices that you're making about when you're writing an abstract. Is it going to be like a vignette? Is it going to be a clinical vignette like you were talking about, Graham? Or is it more like a research project where you've collected some data and analyzed it using formal methods? Or is it more like a QI project where you're kind of tweaking something? And each of them is going to ask you to tell the story in a slightly different way, because there is a culture in each of these buckets about sort of how they think and what they're used to hearing in terms of how storytelling goes. So your first and foremost thing when you're writing an abstract is get the instructions, and they will tell you kind of where they want you to emphasize things and sort of what they want you to put in making choices about which 150 words. So these are the kind of standard outlines. And the way that we're going to walk through today is I'm going to actually spend a fair amount of time on the title, because it's going to give you a flavor for how important style is. And then I'm going to just walk you through one abstract that was accepted at SGIM last year to kind of talk about how people use the space and what kind of choices they made. So in that conversation, I hope we'll be able to highlight kind of what's working and give you a feel for that. I want to say again and again and again, I am always here to review any abstract that you write. And I'm a mean editor. So I generally say, if they say 250 words, give me 350 and I'll make it 250 for you. I'd rather that you communicate your story the way you are comfortable telling it. And I can serve as that reviewer person who comes in as your reader and says, hey, let me clean this up for you. So I'm here to support you. I'm always here. So with that, these are the things that reviewers at SGIM, when they give me a pile or they show them a pile of abstracts, they can come from any number of the theme areas. But in general, they're always looking, is this an important question? If you're going to be talking about something that's a small marginal difference on something, that's just not a hot topic. So part of your thing is you may be making a small marginal difference. So then you spin it so that it is something that's important. Like you don't talk about the results, you talk about the why that marginal difference makes a difference. So that's the first thing is grab. You're going to grab someone with a title, you're going to grab someone with a story. And this is where, why should I stop? I'm going to poster session. There's 5,000 posters, right? Why would I come to yours? So this is the first part. And then once you have a good project going on, it's always about the quality of writing in terms of, did you make the right choices in terms of your sample, in terms of the questions that you asked, in terms of how you analyze them? They are looking for a coherent project that makes sense from start to finish. Again, these are the things I can help you with. And then in storytelling, if you set me up with a problem, you tell me how you're going to fix it. You give me some results that tell me how you fixed it. And then you tell me at the end what matters and what I'm supposed to do about it. That is the framework for the story. And concise and good writing is where each idea doesn't have to be repeated because you've laid the foundation for it to flow. So you should never say anything twice in an abstract. And you're going to think of it like an elevator pitch or like kind of an argument. And I'm going to use some of these abstracts to sort of show you what I mean by that. But this is sort of the background. You're sort of saying, hey, this is important. Hey, this is what we did about it. This is what we found. This is what you should do. And even in 150 words, you can do that if you keep those 4 kind of ideas in your mind. Does that make sense to y'all? Does that resonate? Okay.
Should we be writing hey in the abstract?
Hey, we'll see if anybody has that in a title. So my pitch to you, and this is a 500-word story because that's how much SGIM gives you. So it's more painful when it's 150 for sure. But like I said, write the 500 one first, and we'll figure out how to trim it to 150. They always know if they're only giving you 150, you can't do as good a job. So that's where it's important to sort of just maybe aim a little higher. And the way I like to think about like 150 word versus a 500 is like the 150 is like the phone call to get the interview. The 500 is like the essay you submit in advance so that they're prepped to know you, right? And that's kind of the difference. So if it's just a phone call to get to know you, they know you can't do the best job. They didn't give you enough room to do it. So then you have to tease them real hard that what you've got is worth the time. That's really what you're trying to do. But the same principles always apply. Know your audience, get their attention with your title, make them care, show them that what you did was solid, and then leave them with a strong take home. So that's kind of the moral argument framework here. And then your task is to hang your details on that framework. So first we're going to talk about your audience. And at each of these meetings, when you're submitting an abstract, they do you the big favor of telling you how they plan to group the sessions. And so essentially when you're looking at these categories, it's the part in the abstract book where they're going to put all the communication stuff together, all the med ed stuff together, et cetera, et cetera, et cetera. So if you're thinking about going to the meeting and you're either going to the sessions where they're presenting things, then you're sort of choosing where you want to pitch. So the important thing here is not to necessarily think exactly of the perfect match between your work and this audience, because sometimes you might do something that crosses some of these things. So the important thing when you're taking this box is like, who are the people in the room that I want to talk to about my project? And that's how I like to think about these, because you're sort of prepping yourself. So Lindsay, you'd probably be in, I don't know, geriatrics here if we're going to, maybe you're in translating research to practice. I don't know. If you go over to SGIM, that's geriatrics and palliative care. So this is why for each one, you really want to be paying attention, because you might have the same abstract for 2 meetings, but the audience might be also just slightly different in terms of how they configure them. So I like to really pay attention to this first and really think about this question, because once you get this down, the rest gets a lot easier, because you're not trying to be all things to all people. And part of what it means is that if you have to shorthand, you kind of know what the lingo is in each of these. Like, they don't spell out DEI in the DEI group because the DEI people know what that means, right? So in a way, it's kind of like you've got an insider group so that you can be speaking to peers and you don't have to start at like 101 level because they're choosing to be in that room with you. That means they know something about this. It means you can advance the conversation with something that's more than just the beginner level. Does that make sense? So that's the first thing. And then that helps you start to think, okay, what is this audience going to care about? And so what could I be telling them that would be cutting edge? I don't know about you, but I often go to meetings and then I go to the session, that's the thing that I study, and then I don't learn anything new because I'm up to date on that. So I sometimes like to go into a room that is kind of adjacent to me, certainly when I'm listening to other people so that I can learn something new. But you might also try that to pitch something that you're like your message to a different audience and see how it goes. Like if this is not news to your folks, but people next door, it's like really something interesting to them, then consider doing it that way too. So it's not always just a direct line is what I'm trying to say, but a thoughtful choice. So now we're going to play with titles. And here's what I've learned over time. I think this is also a little bit true kind of with aims, but there's a style to how you write a title. And so this is where you can also really hone in on your audience and like, how hip are they? Are they super woke? Are they, super conservative? Do they only think in numbers? Do they actually like words and stories? Like you can kind of think about what would be the grab. You're going through that hall, you see a million titles. What's going to be the one that makes you stop, right? That's what you're after here. So the vast majority or some description, the grass was green on Thursday, a retrospective case study, they might just, like I said, they might be a randomized trial on. So they're kind of leading with the method to let you know, this is an RCT, guys, pay attention. It's a rigorous design. They might say, do we know how we feel at 3 o'clock on Friday? Come and find out, right? So they'll ask a question to kind of like, oh, I don't know, that sounds interesting. I want to go know the answer to that. Sometimes they'll ask a question and then they'll give you the results. Do you know what happened at 3? The bells at my church just rang. Okay, that's my abstract. Come and learn all about it. Sometimes they'll just say the results so that you're just leading with a punchline. And then sometimes they will say, this is what you should do. So we're gonna have a test here and I'm gonna do some lightning rounds. We're gonna go fast. And that means I'm gonna call on you. So be ready. And whatever you say is either, it doesn't really matter. We're going to give it a try and maybe the rest of us can kind of thumbs up to give us courage. And if you have a different idea, here we go. So use of virtual scribes associated with significant decreases in electronic health record time by ambulatory physicians. What? So you guys can all come off mute now. What kind of title is this?
Results.
Yep, perfect. Comparative effectiveness of care models to improve pain and reduce opioids among VA primary care patients on long-term opioid therapy, a pragmatic randomized trial. Description and methods, right? Okay, and just notice how long, I also like to read a title on a breath, and if I have any at the end, it's kind of a miracle. Like, do I need my opera voice to be able to actually get to the end here, or what? So this is super long, tells you a lot of information, but I've fallen asleep mid-sentence. It's like way too much to process. I'm an editorialist a little bit. Okay, podcasting, a large net in addiction medical education.
Description.
But also play on words, like, ooh, get it, wink. This one's, so look for the winks. That's probably one that I should put up there, because this would be when the hipsters are speaking to, like, do you get this, right? So they're trying to show you that they're a little fun, they're a little different, and that was clever. So witticisms and clever can help because, I mean, did you respond? Like, oh, that was a cute joke. So that kind of thing is just anything that's going to get somebody's attention and just have them pause and wait, oh, that's all you want is just that leaning in and going, huh, I want to read the next thing, because that's what a title is doing. All right. How ready are our near graduates to be on call? Some are and some aren't.
Question
Right.
and
Yes.
results.
Right. And this is, I think, kind of the epitome of the elevator speech title, because this sort of gives you the super precise and concise snapshot, but interesting. I will say, and sometimes abstract proposals will ban asking a question because they can be too cute sometimes. But when it's done effectively, it is one of the best attention grabbers, because cognitively we listen differently when we're being asked a question than when we read a flat description. So they have more grab inherently based on the way our brains work.
Helene, can I ask a question about this one? So what do folks think about this title? What is your reaction? If you were walking through the kind of poster hall and you saw this title, would you stop and kind of want to read this one? Or if you were reviewing this, what would you think about just based on the title?
I'd be like, who is ready? Who is not?
Okay.
I feel like the result is already given in the title, so I feel like I know what the answer is.
Yeah, it's like, all right, so you told me. Any other thoughts?
The question I'll ask myself, what tools do they use to know who is ready and who is not? How do they measure that?
That sounds kind of more interesting than the result, to be honest. If I saw this, I'd be like, all right, I mean, great. Some are ready, some are not. I could have told you that without doing the study. So I just wanted to interrupt to make that point that, you know, this doesn't seem like something that I would really want to learn more about. It's kind of like stating the obvious. So I would avoid stating the obvious in your attention grabbing title.
Yes, and some people wanted to lean in.
Yes.
So in that way, the consumer of this has been given a really explicit choice where they don't have to waste their time. So if they think that that's it, and basically, okay, good, somebody did research to confirm what I already knew, great. I don't need to stop by and learn more. But if one of you are in med ed and you're like, ooh, well, what? Yeah, tell me about the ones who did. Ooh, what would I do better if I knew who the ones who don't? Like, you may lean into that. And it's a poster, so it's okay if you screen some folks out. It's fine. I think whatever makes the storytelling effective is the most important thing here, right? So sometimes glib might send people away. Sometimes you might draw them in. You never know who's actually going to respond. This is a good thing to pilot with another author. So even if you're really cute, then give it to somebody else and make sure it lands well. That's would be mostly my advice, because we can't see when we think things are funny if other people think they're kind of dumb. So good point. Thanks, Sean. All right. Practice variations in food insecurity screening. One size does not fit all.
Results, conclusion.
Conclusion, yeah.
Mm-hmm. So it's, yeah, so this is sort of the last and sort of another way where you can kind of telegraph what's going on. And again, this is pretty obvious, so you might walk by this one too, unless you wanted to know, well, how do you account for variation? So that's when the title is the grab, and then the next piece has to give them enough to make them want to stay, right? So this is sort of the 1-2 punch. It's never these things in isolation, but you want them to pause. And then if they read the next sentence and it's like, that's what they're in for, they're going to keep reading. And that's what you're going for here. So you guys got them all right. When we think about this one, how ready are your graduates to be on call? Some are and some aren't. Who's the audience for this? When we look at this list, where would we be pitching this abstract?
Med ed, probably.
Yeah, that's where it came from. It could also be healthcare design, design and redesign if we were going there, right? And I don't know that it would be clinical informatics. This just happened to be the green color that was on there already, so I just put it up there. But this is a good thing for you to kind of think about, how does that fit? So, all right, we're going to go on to the meat of it now. So this is that comparative effectiveness pragmatic trial. And this is the place where you're kind of bringing in the harps and the violins, right? So the whole point about the background here is the importance. So you're making your pitch, you're often maybe hitting a moral argument. So we're basically saying people are at risk of unrelieved pain, poor outcomes, serious adverse events. And then you're leaning on the establishment here as your background, that guidelines say we're supposed to do something, but we don't have the resources to do it. So in 3 sentences, they have told you who's affected by this, what are the consequences when things don't happen, and we're not alone in thinking this is an important problem. We've leaned on guidelines, which is sort of like saying, you know, God said this. So like when you invoke institutional practice, it means that you and everybody else who's already cared about this recognizes this as a problem. So that's what people are doing when they cite guidelines, is they're sort of saying, see, me and everybody else thinks this is important. Here's what we're doing about it. So then they tell you a little bit about like this group. So they establish their cred as an institutional group. This whole thing that people are putting together. And because this is a pragmatic randomized trial, you have to say that kind of thing, because you have to know, you know, is there enough of an infrastructure here? So you're essentially pitching your own qualifications. So that's why they put this in. And then they're just talking about aim 1 here. So the whole project is bigger than what they're reporting on. But what they're telling you by just writing aim 1 is that that's the piece that we're going to talk about today. And that's what I mean if you had kind of laid out all your 6 ideas, they like picked aim 1 to talk about. And they signal that by just using by just being very succinct and not wasting like a whole lot of words to get to this. The thing about this that makes this writing really clear and to the point is it's straightforward sentences. And there's no preamble like in order to. Or the other way is people will write a sentence that gives a long introductory clause, a comma, and then the point. So if you have to go, la, 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 we're going to do this, you put the we're going to do this first. And that is how you get rid of a whole lot of words. Sometimes after all that, you don't even need those words anymore. So if you need to cut words, that's how they go away. Or you can make it a lot shorter. So when you look at this writing, it is very straightforward and to the point. There's no extra word here. But it's very data rich. So it's still kind of a mouthful to read this, because compare higher intensive pain, IPT, you start to get into the acronym HAL here. And this is where, if it's a pragmatic randomized trial, they kind of have to get this nerdy. There may be ways that you don't have to be quite this rigorous, but it has to align with your method. So if you're using the most rigorous methods, you have to show that rigor by doing it the way that kind of stuff gets reported. And this is the sort of thing that makes that possible. So just reading this, you have confidence that they know what they're talking about because of the way the words are organized. So that becomes one of those review criteria about clarity of writing that is coming through, because each sentence is just really crisp. It's got a lot of information, but it makes a lot of sense. Does that make sense to you guys? You see that? And so this part is both what's at stake, then kind of what are you trying to do? So the last part of, in my view, any good anything, an introduction, background, is setting up the purpose for what's going to come next. Because if you've got this big thing, you've got this problem, the goal of this abstract, the goal of this project, the goal of this thing is. And it's almost like spelling out a hypothesis that then the rest of the writing is going to demonstrate, right? And it also doesn't leave the reader to choose what you're going to talk about next. So it helps you maintain control. And then what you choose to follow basically just responds to that purpose. So again, this is a place where if you can be super clear on what the purpose is, then everything that follows is basically just telling us how you achieved that. Does that make sense to you guys? So here, aim one was to compare higher intensity pain treatment team versus lower intensity pharmacist telecare collaborative team or management, so IPT versus TCM, to improve pain and reduce opioids. And then they say, we hypothesized that the integrated pain team would be superior to the telecare collaborative management. So they have told us now everything that comes next is going to answer that question. Does that make sense to you guys? So that now you don't have to explain a lot of stuff next, because all we really need in the next bit is what answers that question. So I'm going to pause here and see if anybody has any comments or thoughts or questions about this. All good?
Can I
Okay.
ask folks, what do you see in this writing that you think makes it effective? Just kind of throw out what you see that makes it effective. I think, Helene, is it fair to say this is a well-written abstract?
Yes.
Okay.
I like the background. Like this is the kind of the problem, and so what are they kind of offering as a solution?
Okay. Anything else?
But they're really specific about what they're measuring and how they're doing it.
Yeah,
Right.
specificity, I think, is a great characteristic.
Okay, in the interest of time, I'm going to just keep going here. So the next part is you sort of set them up to trust you. Now you have to deliver on the trust by making sure that the way you're giving the results and then sort of how you go about talking about that meets rigorous standards. So again, this is a big study. If it's a pragmatic randomized trial, they've got a big budget. It's a funded thing. So you're going to want to know a little bit about that consortium. And so the first thing for this, they're just giving you that data because they're basically anticipating what are the questions that people want to know. And they want to always sort of in a big study like this, everybody wants to know something about the setting because that's super important. That drives all the results. So you're going to talk about that. And then they're going to, because this is a randomized trial where they're comparing two interventions, they want to understand sort of like what are the rule-in criteria, and then who did you actually get to roll in. And so, tell us a little bit about the sample and, what your measures were, and then how you got to it. So a lot of these are the details that are basically answering those questions. And then they describe their intervention so that you understand what they're comparing, and that's super important. And they have done their very best to make these one sentences, even though they're big, so that in one sentence, you understand what the intervention is. So when you read that, do you guys have a sense that these are really different kinds of things just from this one sentence versus one sentence? Can you imagine this, right?
Mm-hmm.
So in both cases, somebody is talking to the patient, but who that person is and kind of what's going on around it and what they're doing is really different. So one's kind of motivational interviewing to make sure that they're doing what they're supposed to do. And the other is, sort of telemonitoring and conversation. So when you're thinking about operationalizing this or thinking about like, gosh, what would I do in my environment? Those are really different, requiring really different kinds of resources and really different kinds of organization. So this helps us see these are very different kinds of intervention, and they both probably have some face validity that they could work, right? They probably got here after doing that sort of thing. Then they talk about what they measured and how often they measured, and then what their primary outcomes were. And so this is all sort of setting us up to understand what the statistics would look like. And then they tell us sort of what their frame was going to be and that they're going to do a logistic regression. So everything, again, you can tell these are people that know what they're doing, and it sort of follows the rigor of method. And even if you don't know what any of that means, it's still kind of convincing, right? So then this is the typical results from something like this, which to me is just a whole lot of numbers, and it's really hard to figure out. So when I do things like this, I'm like, okay, same samples, all right, they look the same, that's fine. And then I just skim to figure out what do I see here. And I'm like, I don't see anything. There's nothing here. And it's a negative trial. There's no difference. It's a negative trial. They bought it published because it's a rigorous trial and because you don't spend this kind of money and not report the results, right? So I want to point that out. And then they tell us that they've also planned for subgroup analyses because while they had a hypothesis that one would be better than the other, they were like, but it might not work out that way. So they've already built in their sensitivity analyses from the get-go. And again, I'm just feeling better and better about these guys because I feel like they're telling me things that demonstrate they're thoughtful people, right? And so there's part of it that's in what they say, but there's a lot in how they say it that just gives me confidence as a reader. Like this is legit, right? I need to pay attention to this. This was a rigorous work. And so, then from there, this is what they finish with 2 sentences. There was no difference between these interventions. And so think about what makes most sense for you. That's the take home. That's not earth shattering. That might be just the same as, some learners are ready and some aren't, right? You've gone through all of this and you kind of get to the same point. This sort of reinforces what we already knew, but it was rigorous science to get there. And we spend money to do these things because these are questions we want answers to. So I'm going to pause there. For questions and comments. What do you guys thought so far? Specific questions about, how you might trim? Let's go back to some of those. Those of you who are trying to figure out how to choose, what did you learn here that might make your editing more easy next time?
Wayne, do you want to stop the slide share? And
sure.
yeah.
If I can find it.
I found that I was actually interested in the outcome as we went along. Like even just kind of based on the abstract, I was already interested in the outcome.
So why? What was grabbing you?
Well, I think for one, it's a field that I work in, opioids, pain management. And so there's a curiosity in different ways. Different ways to deliver education or information. And so I feel like I probably had a vested interest in this process. Applicable.
And the thing that I took from it is, even not being a part of that particular field per se, is that if you're going to write a good abstract about something, you need to have really planned ahead for your research in the first place. Like if you have a good plan for your method and how you're getting there and your purpose, then it'll be easier to write something, which is probably where my problem lies sometimes.
Yeah, I would like to echo that, Lindsay. I think that the hardest part is to get clear on what your purpose is. For this particular piece of writing, I will say, right? Because it's the chapter in the book. It's not even the book for the story. So it's parsing that exact alignment between this story and this audience with this purpose. Like, what do I want them to know when we're done?
And actually, can I say it real quick? This is probably like a whole another session, but when you're working in an institution where the institution is asking you to do particular things and you have an interest in particular things, and I don't know, you have like 7 bosses from 7 different organizations, I bet that's a part of the reason why it's really hard to have a purpose. It's very straightforward. So we can talk about that sometime, but how you actually
I think that's January. I think that's when we're going to talk about how to write a project proposal. So yes, stay tuned. Come back for that one. Ermias, what did you take away from this?
Well, I think the background, the rationale and the methodology were very clearly outlined. So it was very attractive to follow and read the abstract. But when it comes to the result, I was like, oops, kind of. But I admire again the conclusions they gave. It is like a very well thought conclusion. It's that based on resources, any of the delivery methods can be used. So that's very nice. Yeah, but in all, I think it is very nice that you brought this kind of abstract, because most of us will be discouraged when we have a negative finding to continue to work for publication and so on. But this is very good example on that. And then I was just looking at the number of words they use. Probably it is, I think, very long abstract.
Yeah, these are 500 words.
Yeah, so I think that was
So, you know,
aimed
what they
for.
would have done in the results is probably just say there were no differences. They would have
Yeah.
taken, they would have just like taken all of that out. They would have said, you know, the mean was this. There were no differences between the groups on this, and this.
Yeah.
So there'd be ways in which you could still telegraph the information, and especially if there's no differences, you don't have to show all the stats. And if there are differences, then if there are differences on one thing but not 6 things, then you say there's no differences for 6 things, but there's this one difference. And so you don't give them all the details on the things they don't care about. This they do in part because they're trying to show equivalence. This is really an equivalence study. And to your point, if your results are negative, but your methods are rigorous, you know, there is a bias against not publishing negative results, but if they're negative and rigorous, that's data. And that's important. And I think that's where, you know, if you have crummy methods and crummy results, you don't know if the results are crummy because the methods are crummy. So if you don't have great results, then make sure you're coming across real strong on methods. And again, I can help you with all of this. So if you're like going, this is what I'm here for, so please reach out. I can really help.
I think, Ermaya, I see you were still talking.
Sorry.
No, it just Helene's things and on what I started.
Titles. Did anybody shift a thought about how they might write a title next time? I would suggest that you try writing at least 2 styles or 3 maybe. So the first one that most people do will be a descriptive. So if you do that first, can you just try writing another way? Luke, you were gonna say something.
Yeah, I was just gonna say that I always kind of default to a just boring, this is what I did, and I've never thought of titles within a style before, and I think exploring that and maybe even exploring into the more fun titles is something that I'll do at some point.
I mean, there's a difference between academic prose and button down dull. You know, and I think what we think is that the only kind of academic prose is the kind that allows for super pointy heads or super tight collars. And in fact, all of us are academics, right? And when you're at a meeting, everybody's there kind of having fun. So you can be rigorous, but not starchy. And I think again, people are bombarded with messaging all day long now. Like it's at you all the time. So starchy doesn't have the same grab that it used to. Approach and connection is what you're after. You know,
I want to call attention to time here. Yeah, 1 o'clock. Thank you all for joining. I think I'll just reiterate, this is the beginning of a conversation. Let's please continue to stay engaged with, if you have other questions or thoughts about writing abstracts, reach out to us. We can work together.